Okay, so this is our wonderful patient, Mr. Jesse Lay, and he had a particular bothersome problem. He developed vitreous floaters, and actually specifically a vitreous detachment. And what happens is in the back of the eye, there's this jelly in this space here, and he developed an opacity that really disrupted his vision. And so I'm gonna have Mr. Lay share the problems that he had, and then what we did for him, and how he's doing now.
Yeah, if we went all the way back to the beginning, it was some ordeal, and it had a number of little floaters that would pass by. But even more than that, along with that, it seems to be if you moved your eye left to right and back, there was like a little cloud that went with it. Right. Certain days, especially if you were driving, cloudy days and so on, it would really bother you in ways that you wouldn't think. You not only see the floater, but the cloud there was like a skim.
Right.
When it would pass by, and it seemed like sometimes it would just stay there. But when I came in here and you told me about the laser surgery, right, that it could bust them up, I guess it would be the term. Right. You did that a couple weeks ago, and it's amazing already the benefits that I have with them. I see some little tiny floaters here and there, but it seems like they're less than they were right a week ago. Right. But it's helping a lot, and I certainly appreciate everything you did.
Thank you, Mr. Lay. I appreciate you sharing that. So, you know, Mr. Lay, we talked about this. Before this laser was available, we would tell people they just had to live with it. Yeah. Of course, you could have a surgery, but that's pretty invasive, so most people wouldn't do that.
I would not have done it.
So we've been able to offer this laser to patients, and I don't think a lot of practices in the area actually have this laser, and thankfully we do. And in addition to you, we've had quite a few patients who've had a huge improvement in their symptoms. It's safe, it's quick, as you remember, and it really takes care of the symptoms. So
I think the safety part of it sold me on it, because it was bothering me enough that I wanted to do it. But when something is going on in your eye, it's bad enough that you have the problem. You certainly don't want to make it worse.
That's right. So you knew that it was safe, and yeah, of course, when you had the procedure, how was it?
Oh, it was really good. Yeah. No problem at all.
Any pain or discomfort?
No.
How long did it take? Do you remember?
But I tell you what bothered me most is the dilating the eye. Other than that.
Right, and the procedure took what, maybe a couple of minutes or something?
Yeah,
not too long.
No, it was very short, and if you have to have a surgery, that's the way to go.
Yes, sir.
Yeah.
Well, thank you so much again for sharing your story. I think it's going to help some people who are watching.
Well, thank you for the excellent job that you did.